Hi, I'm Dr. Fran Weaver. I'm a research psychologist. I am with the Department of Veteran Affairs, Center for Management of Complex Chronic Care, and also with the Department of Medicine here at Loyola University Medical Center. I will be speaking about a paper we just had published in the New England Journal of Medicine comparing two targets for deep brain stimulation for Parkinson's disease. Deep brain stimulation is a non-invasive procedure for individuals with movement disorder problems such as Parkinson's disease. It involves inserting electrodes into an area of the brain that's related to movement. Those electrodes are then attached to a battery that is usually placed underneath the skin in the chest area. Certainly, there are two areas of the brain that surgeons have targeted to address motor problems in Parkinson's disease. One area is called the subthalamic nucleus. It's a very small area deep within the brain. A second area is the globus pallidum interna. That is a larger target area also deep within the brain. There has been the assumption for many years that the subthalamic nucleus is the most appropriate target for stimulation for individuals with movement problems related to Parkinson's disease. That assumption is based on a number of case reports and not on level 1 evidence. Individuals who have done this research have identified that individuals who are stimulated in the subthalamic nucleus experience significant improvement in motor function, and at the same time the medication that's used to manage Parkinson's disease, levodopa, can be reduced sometimes dramatically as a result of the stimulation. However, more recent reports of subthalamic nucleus stimulation have found some adverse outcomes. What we learned, we did a head-to-head randomized control trial of subthalamic nucleus and globus pallidus stimulation for individuals with advanced Parkinson's disease. What we found in that trial was that motor function improved comparably with both targets. We also found that quality of life also improved similarly in both populations. I think the most important finding from this study is that we now can use two different targets in the brain for addressing motor complications of Parkinson's disease, both the subthalamic nucleus and the globus pallidus. We did find some subtle differences in the two targets. For example, we found that depression worsened slightly for individuals who underwent subthalamic nucleus stim, and it improved slightly in the globus pallidus group. We think that's related to medication. So individuals who have subthalamic nucleus stimulation, usually you have to reduce the medication because the stimulation can actually cause something called dyskinesias, which is a wild flailing of the arms and legs. So you want to reduce the medication to compensate for the stimulation. However, the medication may actually be addressing some of the other symptoms of Parkinson's disease. They may actually feel better when they have the levodopa. So reducing the medication may actually bring on some of the depression. We didn't find that in the globus pallidus because you don't need to necessarily reduce the medication in the globus pallidus target. I would just like to caution that this is brain surgery and there are serious adverse events that can occur. Approximately half our patients did experience serious adverse events. The good news is that we are able to address those serious adverse events with other interventions, including changes in medication, providing antibiotics and other kinds of interventions, and we were able to resolve 99% of those adverse events.
I think that paper does suggest that we may be further selective in terms of in target selection, so it's not just patient selection. So the globus pallidus target for DBS surgery may be a little bit more difficult to target at times. However, it may be safer. So in patients who are older or who have cognitive issues, we may now perform that surgery targeting the globus pallidus as opposed to the subthalamic nucleus. In general, the STN or subthalamic nucleus location is probably easier and probably known by more surgeons, and more surgeons are comfortable using that target.